Hello, everyone. I am Dr. Devina, and today I will be talking to you about a new station on EBCOG Part 2, which has been introduced in the last few times, which is the topic of presentation of a PowerPoint. So, because this is a new station, we sometimes can get very anxious about it, but let me break it down to you with some examples and hopefully it will become more easier for you. Okay. So the station goes like this. So it basically involves two stations. The first station is the preparatory station, followed by the second station, which is the presentation station. So what is involved in the first station? You have 1 minute of read time where you will be told that you have to prepare a presentation to present in front of the audience, and you will enter the station. In the station, you'll have a computer which has PowerPoint, but you won't have any access to the internet. So you'll have 10 minutes to prepare a presentation. They usually have information about the topic, the number of slides that you have to prepare. It's usually 3 slides that you have to prepare, followed by in those 10 minutes, you save your PowerPoint presentation and then you move on to your next session. Again, the 1 minute in the beginning is the preparation time where they usually have a pen drive in which they help you to transfer your presentation and take it to the next station. When you go into the next station, there is an examiner there, and you plug in your device. There is enough time for you to do all these things. So don't worry about the time. And the people are there to help you. So don't worry about it. And once your presentation is up on the screen, you can start your presentation. That will be done for the next 10 minutes. Also, it involves timing for the examiner to ask you some questions. So be prepared for that. If you don't give the examiner time to ask you questions, then you lose out on the marks that are allocated for that. Okay, so make sure you manage your time properly. Some do's and don'ts. So usually you have to present 3 slides. Try to make your content more attractive and engaging. Try to engage with the examiner in your presentation. Use of tables, smart arts, charts, figures is good because it's eye-catching and prevents the presentation from becoming boring. Have a good time management, that is, for all the content that you have to present, allocate equal amount of time, including the time left for answering the questions of the examiner. But this shows a good planning. And also correct alignment and correct sequence of your content. Okay. Avoid very flashy and bold colors because we need to be professional in our presentation. Avoid long sentences and avoid trying to put too much written information in one slide. Your number of slides are limited, but try to only give bullet points and then elaborate verbally on them. Okay. Avoid a monotonous speech delivery, and avoid speaking too fast or too slow because the examiner might not understand everything that you say if you say too fast or too slow. Try to be as clear as you can in your delivery. And also avoid a slide where there are too many pictures and too many shapes or charts or sentences. Try to keep it minimalistic and simple as well as informative and crisp at the same time. So what I would suggest is you try and do a few presentations. Take your time for 10 minutes and prepare a presentation and then deliver it for 10 minutes. We will give you some examples of the topics that have been asked in the past exams and that could be asked. So you can use them to prepare your presentations. Okay. So these are a few common topics that might be asked or that have been asked in the previous exams, that include oasis or perineal tears, tocolytics, primary amenorrhea, sorry, the tocolytics has been repeated, antihypertensives in pregnancy, OHSS, hyperemesis, malpresentation, and PID. Okay, so this is an example of a station that might come to you. So this will be the preparatory station that you have. So the instructions would read something like this. In the next station, prepare a PowerPoint presentation to deliver a talk on OASIS or perineal tears to a group of obstetric doctors having 3 slides. You will have 10 minutes to prepare the presentation and would be transferred to the next station where you have to present to the examiner and answer any questions in 10 minutes. They will clearly mention the time that is allocated for preparation and the time that is allocated for presentations. And sometimes it might say that, and also answer the questions of the examiner. So be careful in reading the questions and what it says. Now, this gives you the topic, this gives you the slides, this gives you the time, and also this tells you that you have to present to a group of obstetric doctors. So, your delivery or your presentation should be targeted to the audience that you're delivering to. So, obstetric doctors means that these are not medical students, or these are not consultants, or these are not layman people that don't know about this. So these are doctors that know about obstetrics and gynecology. So your talk should be as per your audience. They can mention to group of medical students or to group of consultants or in a conference. So your content should be managed according to the audience that you're going to present to. Okay. So I will show you how to prepare the presentation. Okay. So let's get a blank presentation. Okay. So in this blank presentation, you have 3 slides. So we can add 3 slides for now. First slide is the title slide. Of course, if we take the example of OASIS, so that you write your name. You can write the date, which is example. You can also write candidate or EB Synergy OSCE exam. These are, just make sure that your title is bold and big enough, and this is your title slide. Now in OASIS you can decide on what you want to talk about. So for example, in perineal tears, what you can talk about is types. So we come to the second slide. We can write maybe types, and then you write management, and then you can write so patient counseling post procedure. Before this you can write risk factors, and in the end maybe we can write prevention. So this means that you would be talking about all these things. Now if you want to add a text box, you can. So for adding the text box, we go on insert and add text box, and then you can add a text box. You can move this text box, and then you can, in this you can start writing types, type 1, first degree, second degree, and so on. And so on. So you can write this and you can use a text box. You can change the fill of the text box. Maybe you can put different colors inside it. You can change the font of the text. You can change it, make it bold, increase the size, decrease the size, or if you want to not make it bold, then you can change that. You can change the font, but I would just say keep a font that is simple. Avoid a font that is difficult to read, or avoid a background that is difficult to read. So otherwise it can become quite challenging for them to see it. On here, you can write introduction. So when you start, and then these are the points, then these are the types. What other things that you can add is if you go on insert, you can add some pictures. But again, you won't have any access to the internet. So it will be difficult to put any pictures on. But what you can add is shapes. So for example, if you want to add a circle, then we add a circle, and then you can write inside steps or repair if you want, and then you can put bullet points and add 1, 2, 3. So you can make it like that if you want. So you can just arrange it that way. If you don't want a circle, square's fine. It's all up to you. Avoid using like if you use a dark background, make sure the font is light, otherwise it will be difficult for them to understand and see what you've written. Also, make the font big enough so that everyone can see, and also accommodate all the text that you've got. So be very cautious of these things while using the color scheme. Also, I would advise to avoid a lot of colors, maybe stick to one color scheme, but avoid using a lot of different colors. The other thing that we can insert is a smart art. Some people are not very familiar with this, but this is a very good way of making a list or showing a cycle. So any smart art you can use. So for example, if we use a smart art instead of just writing these things, so you can directly write here types and risk factors, then prevention, and then you can maybe remove this, and here you can write instead of introduction, definition, and then you can move this so that, and you can change the colors, increase or decrease the size and other things. So it just makes it more appealing to the eyes and less boring, but at the same time, very clear. The other thing that you can add, I'm just showing you in this example, is a table. You can use how big or how many columns and how many rows you want in the table. So you can use it, then you can change the color and the type of the table. You can change the font of the table and to make it as per your liking. All right. The other thing that we can do with the presentation is add some transition to our slides. So if you come on the transition tab that is here, so we went into insert, we tried and inserting all the different things. Another thing that you can insert is a word art. Again, sometimes it can become a bit, so if you want to write definition, just use it there. Delete this. So it's up to you how you want your presentation to be and how comfortable you are in using all these different tools. Okay, you can again change the font, change the pattern, change the style, change everything, but make sure that it is visible and legible. Now we come to, so if you go here, there is a transitions that you can use. So if we go into maybe wipe, so which means that your next slide would come as a wipe or a split. So it comes as a split. If you see on top here, it shows you a small star, which shows you that this slide has a transition in place. The other thing that we can add is animation. Animation means for each individual text or each individual chart or each individual figure, how you want it to come. It can fly in, float, fade, anything that you can decide. It's just next to this. And then you see here a 1, which means that this is on your first click, definition would appear. And then if you say, oh, you select this and then you say fade. So it would say number 2, which means that this would come on the second click. So on your first click, the definition will come. On your second click, this will come. Your last slide should ideally be a thank you slide. So you go on home, you can change the layout of the slide to either a blank slide. Let's delete the table. So you can either a blank slide, or it's in the home in the layout, or you can decide it to be a title slide. It's up to you. So you just write thank you and you write any questions. So that gives the examiner a chance to ask you any questions. And it also shows that you have kept that in your mind and included it as a part of your presentation. It's good practice. That is something that you can make in your last slide. If you think you have too much to put, you you can use the second slide and the thank you can come as a pop-up in the second slide, but make sure you don't make it too much information or too much text. So this is an ideal last slide. Now, the other thing that we can do to make our slides more beautiful is use a theme. So if we go on design, there are different types of slide designs that you can use. Again, I would advise use something that looks professional and is also makes your text pop up but doesn't make it look very flashy or difficult to read or difficult to understand. So keep it simple. We can use this if you want, and then there are different color schemes that you can use. So let's choose this one. So your first slide looks like this, and then that's your presentation. And always check after you've done everything. You go on slideshow and check how it is looking before moving on to the next station. So if you see from the beginning, it comes like there is an animation to it. And then when you click, the first thing comes, and on your second click, the pyramid comes. And then you go on your last slide. So make sure that whatever you are intending to show does appear on the screen as you want it to. I know it is too much to do in 10 minutes, so you have to be really clear. So the 1 minute that you get for preparation time in the first station, use it to plan what all you want to put in your presentation. If you are finding it difficult to use all the tools, I would advise just simply write your bullet points, and that's fine. Even if you don't use all the transitions and animations, that's absolutely fine. If you don't use the background scheme, which was in design, the slide design. If you want to keep it simple, that is also fine. You are not going to get marks on how beautiful your slides are, but you are going to get your marks on how presentable you are and how effectively you have covered the content. So and again, your content is dependent on the amount of information that you have on these topics, which is fine. Whatever you know, you should be able to present it in the best possible way. So they are looking at that. They are not looking at the beautification of the slides. So what I would ideally say is, for your time management, maybe try and finish your presentation in 7 minutes so that you have 2 to 3 minutes time in the end to answer any questions that the examiner has. If you leave too little time for the examiner to ask questions, there might be 2 or 3 questions which they might have to ask, and then you might miss out on one of them and then might miss out on the marks for that question. So there will be marks for, of course, the content of your slide, the way the slides are prepared, the way your delivery of the content, how you are engaging with the audience, and also marks for answering the examiner's questions. So keep that in mind. This is a very easy station, but yes, it requires some practice with regards to the preparation of the slides and your familiarity with the PowerPoint. So if you are new to PowerPoint, I would suggest that you look up into these topics and start preparing presentations about them, and take use only 10 minutes to prepare a presentation and then present it in 10 minutes. That would be helpful. Okay. We will talk more about this, but that's all for today. And if you have any questions, don't hesitate to get in touch with me. I'm on the groups. So thank you so much for being patient today. See you next time. Thank you and have a nice day.